Diabetes is a chronic disease that affects millions of people worldwide. It is essential to diagnose and manage diabetes to prevent complications and maintain good health. In this article, we will discuss the diagnostic test for diabetes, what to expect during a diabetes test, and blood glucose monitoring. Diagnostic tests for diabetes. There are several diagnostic tests for diabetes, including a fasting blood sugar test, oral glucose tolerance test, and hemoglobin A1C test. A fasting blood sugar test measures blood sugar levels after an overnight fast, while an oral glucose tolerance test measures blood sugar levels after drinking a glucose solution. The hemoglobin A1C test measures blood sugar levels over the past 2 to 3 months. These tests help to diagnose diabetes and determine the severity of the disease. They can also help monitor the effectiveness of treatment and identify any complications. What to expect during a diabetes test. If you are getting a diabetes test, your healthcare provider will give you instructions on how to prepare for the test. For example, if you are getting a fasting blood sugar test, you will be asked to fast for at least 8 hours before the test. If you are getting an oral glucose tolerance test, you may need to fast overnight and then drink a glucose solution in the morning. During the test, a healthcare provider will take a sample of your blood and send it to a laboratory for analysis. You may feel a slight pinch when the needle is inserted, but the test is generally painless. Blood glucose monitoring. Blood glucose monitoring is an essential part of diabetes management. It involves measuring blood sugar levels regularly to monitor the effectiveness of treatment and identify any fluctuations in blood sugar levels. There are several ways to monitor blood sugar levels, including finger stick testing and continuous glucose monitoring, CGM. Finger stick testing involves pricking the finger with a lancet and placing a drop of blood on a test strip. The test strip is then inserted into a glucose meter, which measures the blood sugar level. CGM involves wearing a sensor that continuously measures blood sugar levels and sends the data to a receiver or smartphone app. CGM can provide real-time data on blood sugar levels and alert the wearer to any changes or fluctuations. Conclusion. Diagnosis and testing are critical components of diabetes management. If you have symptoms of diabetes or are at risk for the disease, it is important to get tested and diagnosed as early as possible. By understanding the diagnostic tests for diabetes, what to expect during a diabetes test, and blood glucose monitoring, you can take an active role in managing your health and preventing complications. If you have any concerns about diabetes or your health, speak to your healthcare provider to learn more about testing and treatment options. With the right care and attention, people with diabetes can lead healthy, active lives. Diabetes is a chronic disease that affects millions of people worldwide.